All right, welcome everybody. I see everybody logging in here. We're going to give a few minutes for people to continue logging in. We had over 500 people registered for today's event, so we'll give it a few minutes for any that experience any technical difficulties as they get into the platform for the first time. So in the meantime, why don't we get the chat box all fired up? It's always nice to see what state people are from. So if while we're waiting for people to log in, go ahead and get familiar with where that question box is and type in the state that you are calling from, or city state if you'd like. So that's always fun. Oh, look at that. It's all starting to fill in there. So little thing about that chat box, your answers stay private. So only the moderators of the event, which is myself, a couple other people, and the speaker will see what you put into that box. So whatever questions you have, they do stay discreet. If it's a medical question that's about the content, related to the content, we'll go ahead and answer those on breaks throughout. And we'll have Dr. Jurikson on here with us from Zoetis that will help us get those questions to Dr. Faddock, our speaker today, to get those answered. If it is a question regarding any of the housekeeping things that come up throughout, myself and Stacy Welsh, that's also with Thrive, will be in the chat box to answer those. So feel free to interact as much as you'd like within that chat box. We'd like to hear from you. Looks like we have quite a number of states here. See, I'll just read a few of them off. California, Illinois, Arkansas, Nebraska, Wisconsin. Oh, that's great. Michigan, Texas, Iowa, Louisiana, New York, Michigan, Minnesota. Oh, let's see, who else I got here? Scotland. Okay, you win the distance award so far. Scotland, it's lovely. We've got Ontario, Kansas, Ohio, Oregon, Arizona. That's a comment about being COVID central there. I'm in Central Florida, so I think we've got second place right now if we're keeping places on that. We don't have any participation trophies for that. Those are all gone during COVID, apparently. Washington State, Utah, Oregon, Tennessee. Oh, fantastic. And let's see, we got more we got Illinois, more from Ontario, Arkansas. Well, we have quite a few states here. North Carolina, Kentucky, another Scotland, fantastic. Let's see, any other states? Colorado, South Carolina. So we have quite a few states represented here. My name is Claire Pickens. I'm the Senior Director of Operations for Thrive. We do these events as our thank you to the veterinary community, as well as an acknowledgement that we don't have a lot of conferences to go to right now. So this is an opportunity to get some CE credit without the ability to go to conferences. So hopefully you are able to join us for others. The live version of this will get you today, is going to get you 2 hours of CE credit. The recorded version, unfortunately, does not give you the CE credit. We only register this for the live delivery for the race approved credit, but you will be able to watch the recording on our website. So thrivevet.com/learning, you'll see a number of different classes on there that are about all sorts of different topics. Nutrition, we have suicide prevention on there, hospital culture, other dermatology like ticks and fleas and all sorts of stuff. So, so please feel free to check that out. Great way to engage a whole hospital team in a topic is to look at those recordings. So let me introduce our speaker today. We're very happy to have her. We actually have her twice today. If you didn't already, you can register for a second event today. It's another dermatology topic, not the same topic. So you can do that as well if you'd like. So our speaker today is Dr. Valerie Faddock. She has several acronyms. I'll let her talk about the acronyms. I also like acronyms, Dr. Faddock. So you're in good company here. I like as many initials as you can get after your name. So she joined Zoetis in 2016 with a goal of helping veterinarians to manage skin diseases with less frustration. Received her DVM from Washington State University in 1978, after which she did an internship in small animal medicine and surgery at the West Los Angeles Veterinary Medical Group. She had a residency at the veterinary dermatology followed at the University of Florida College of Veterinary Medicine, and became board certified in 1982. She earned her PhD in experimental pathology at the University of Colorado Health Sciences in 1991, and has worked on faculty at the University of Tennessee and the University of Florida, Texas A&M, and the National Jewish Medical and Research Center. Prior to joining Zoetis, she worked in private specialty practices in Denver and Houston. Equine dermatology has been a special area of interest for most of her career, and she has lectured internationally, nationally, and locally on subjects related to veterinary skin disease, immunology, inflammation, and was a dermatology consultant on the Veterinary Information Network, VIN, and has recent awards that include the ACVD Award for Excellence in 2010 and the Frank Krall Award in 2018. So we are in very good company here. We very much appreciate the time that she's giving to us today. So with that, a little bit of housekeeping. Your CE certificate will come to you via email. It is an email form. Most people just print that as a PDF and save it in their records. That will come about an hour after this session has ended. For the people that were not able to attend, they will not get a certificate, but they will get a link to the recording. So everybody will get a link to the recording after this. So that's how your CE certificate comes to you. And again, feel free to be very active in that chat box, and we will get to your questions. All right, I see in here audio. So, well, you're in the chat box for the person that just asked about the chat box. So audio, sometimes you need to click on your little settings and give it a place to send the audio, whether that be your headphones or speakers attached to your computer, whatever that might be. If you're on a phone, one of the things that we'll hear frequently is that you're only seeing a picture of the speaker and not of the presentation. You need to swipe to see the picture of the presentation. So that's how you do that on a phone. All right, Dr. Faddock, I'm going to drop off of audio and video now. The stage is all yours. Thank you very much.
Thank you. Thank you for, I'm so gratified that so many people are interested in dermatology techniques, and I'm turning my video off too. I just want, sometimes it's easier if you could put a name to a face or a face to a name. But this is my COVID look, and it's not a good look for me. So feel free to ask whatever questions you have, and we'll try to get them all answered. We're going to spend the next couple of hours looking at various dermatologic diagnostic techniques, and then apply them to some patients. So hopefully you'll see why dermatologists are always promoting the value of our derm database. So let me turn my silly little camera off and we'll get started. So one of the things I want to bring to your attention, if you haven't had a chance to see it yet, is Zoetis has a number of resources for you in a website called thescienceofstrongerbonds.com. And this is a wonderful place to go when you need extra extra information about dermatology. There's some history forms in here. There's some sample forms for client service representatives to wrap their words around getting people to come in for a visit. Because one thing we know, and we know this, but our clients don't always know this, we can't make a diagnosis over the phone. And therefore, making a phone recommendation for itchy dogs is very, very difficult. There's just too many things that can cause itch in dogs. And so, especially in this time of COVID, there may be some resources in this website that could be really helpful to you. And so I do have a hyperlinks document that I can send to Claire after the after we finish today that has links to this. You can have a look and see what fits. But there is a virtual dermatology CE course available for technicians. And this is run through NAVTA, and it has been put together by Kim Horn, who's a wonderful derm technician at the University of Minnesota. And what I really like about this is that it is in modules. So it's an hour of free RACE CE if you're a licensed veterinary technician, and you are able to watch it in modules. So if you only have 10 minutes, you can pull it up, have a look, and at the end you get a nice certificate, and you also get some really good tips on not only derm techniques, but also how the team pulls together so that we get better outcomes with these dogs. And so the website is there. If you go to Science of Stronger Bonds, you'll be able to get this link, but I'm going to send it through my hyperlinks document that we send later. So one of the things I always want to start with is care of the microscope, because you know that if you're in a practice with more than one person, the scope gets used by multiple users, and sometimes things get out of whack, and you get less optimal results if your microscope is not beautifully taken care of. So we really want to take care of her. And if we keep her happy, she will last for years and give you the good data that you are hoping to get. So to me, the three principles for a happy microscope experience are: all the team members should be educated on how to take samples and set them up for use on the scope. For example, when we do skin scrapings, we're always going to put a cover slip on top of that material, because we don't want our lenses to get messed up with oil, and we try to minimize the amount of oil that we spread all over the stage, although I have to confess I'm not that good. In most practices, I think it makes the most sense to have a microscope champion, someone who will take care of that microscope and help others on learning how to use it. Clean the scope regularly and check for Kohler illumination fairly frequently. And we're going to go over what that means in a little bit. But at the end of the day, the scope should be clean, and we want to keep it covered so that we can dust off it. And I would recommend that you use a professional microscope service at least once a year to give your scope a tune-up. They can make sure that your lenses are clean, that they're set correctly, so that when you switch from lens to lens, you don't have to spend a lot of time refocusing, and just make sure that this, beautiful machine is operating the way that you want it to. Now, as far as the understanding the pieces, I think you all know how your microscopes work, but I'm just going to point out here with the orange line where you have the light source down there. Many scopes do have a field diagram, and that field diagram is the diaphragm is the diaphragm we use when we start to set up proper illumination for your scope. And then we have, of course, the eyepieces and the objectives, the stage, of course, and then the other thing we work with to make sure the illumination is correct is the condenser and the iris diaphragm. So what about the daily life of your microscope? For your microscope to work optimally, you really want it on a stable surface. So, in some places where I've been, the microscope is actually set on a really heavy wood table, or even sometimes a marble table, so that it doesn't shake when the air conditioning comes off and on. You don't want to really have it on a card table or something that has the ability to shake. And it should be kind of in a little area where you've got plenty of room around it, so we're not, spilling things on it, and it has its own little space. And then whenever you have to transport the microscope, you want to carry it by the base. I have seen people who grab scopes by the eyepieces to carry them, and man, that's kind of scary. You really want to support it. Many of them are heavy, and we want to make sure, of course, we don't drop them either. And definitely keep it covered at night. That will keep the dust off your eyepieces, as well as in your off the the stage and the parts that are moving parts that we want to keep dust out of. Clean your oil immersion lens every time you use it. Very, very important. Clean the stage after any wet mount. Often we'll spill oil, or if you're doing fecals on your microscope, there's the fecal material there, and we want to just make sure that we clean that stage, and definitely clean that oil immersion lens every time you use it. The reason for that is if oil is allowed to dry on that lens, it kind of crystallizes, and you lose what is a very expensive lens. And my big mantra is don't drag your 40X through the oil on this slide. When I get really excited about a cytology, I am the most guilty person to do this. But what we want to do, we always examine our cytologies and our skin scrapings at 10X, but you don't want to go 10 to 40 to oil. What you want to go is 10 and then go backwards to the oil slide. We never want to drag our 40X. That's our high dry, and we don't want to get oil on it for the same reasons. If you do it accidentally, just clean it immediately. And by clean, I mean using a cleaner that will get that oil off of there. So if your scope doesn't have an LED light, if you have an older scope, you really want to turn the scope off, or at least turn the light down between uses. This will prolong your bulb life. If you have an LED light, oh my gosh, they can last for longer than our lives, and so it's less of a worry. But if your scope is older and you don't have an LED, then definitely keep that light down. Now, how do we clean the microscope? You know, one of the things we don't want to do are use paper towels or tissues or even Kim wipes on our lenses. So you can get this little kit for $15 online. Often the microscope is dirty when you have multiple users. So the first thing I like to do is I look at the eyepieces and I spin them around. And often the dirt is not on the objective, it's on the eyepiece. And because a lot of women do wear mascara, you'll often find, you know, mascara pieces on there. So you can clean those off and make sure you have a really good view. You want to blow the dust off, and there's little puffers you can do that with. And then the solvent, you want to make sure that you use a solvent that's approved for your lens. And most microscopists are recommending this Sparkle. It's really, really nice. It's not very expensive. You can spray it on your lens tissue and gently wipe your objectives with it. And it's a really good cleaner. It just makes your lenses last longer. And again, I mentioned that you really want to clean your oil immersion lens immediately to avoid crystal. Water, don't use alcohol, don't use acetone. Those will, in the case of water, you could loosen the glue that keeps your lens exactly where it needs to be. And if you use alcohol or acetone, that will could etch the lens. So only use something like Sparkle and lens tissue. Some people like cotton tipped applicators, and that's okay too. But I don't use Kim wipes or paper towels or anything like that. Now, why do we use oil? Well, it has to do with the ability of the light to be refracted through the microscope correctly. So, you know, when we do our 40X lens, we get a really nice enlargement, and it's clear and crisp with air. But once you get up to an oil immersion, which is 100X, the light coming through, you know, your stage there, when it goes through the air, it's not going to give you a clear image. It's just not refracting correctly. So we really want it to be parallel, and the way we do that is we use our immersion oil. So here's just an example. This is not a cytology, but it's a tissue, and you can see if you use your oil immersion dry, you know, it's fuzzy, the colors aren't intense, you know, it's just fuzzy. Whereas if you use oil immersion, look at how crisp that image is. And you're going to want to do this for your cytologies to recognize your bacteria and yeast. So tips for oil microscopy. I really like the little bottles that you see in the lower right. Rather than getting a large bottle that you either have to use one of those glass pipettes to drop oil on, or even, you know, the larger plastic pipettes we sometimes use. These little things are awesome because the opening is very, very narrow, and you can apply a small amount of oil, and you just get dispersal right to the end of your cover slip. Or even if, you know, if you're doing your cytologies without a cover slip, that's acceptable. It just works out great. So I learned something from Nikon, and that is that when you are using cover glasses, you really want them of a specific thickness. And I didn't even know they came in different thicknesses. So you definitely want to buy the number 1.5, which is, less than a millimeter in thickness, so 0.17. So if you're struggling with your cover glasses, it could be that you have direct immersion oil that has a refractive index of 1.5. And so you don't want to use mineral oil. And honestly, for clinic work, you want the little red bottle type A rather than the blue bottle. The blue bottle is high viscosity, so it's really nice, except you get bubbles in there and it's really frustrating. The red bottle has low viscosity, so we don't get as many air bubbles, and it just allows us to do our cytologies more quickly. And again, I harp on not dragging the 40 through the oil, and if you do, just clean it right away. So we don't want the blue bottle. That's more for research purposes. We like that little red bottle. So what is Kohler illumination and why does it matter? Kohler illumination is meant to create a light source that is optimal for you to be able to see the really tiny things we're looking for on oil immersion. So the parts of the microscope that we're going to use are here. You see the field diaphragm on the bottom. That's where the light comes through, and you see the knurled ring. There's usually a ring there that you can open and shut. And then if we move up to right under the stage, you can see there's a little lever there to open what's called the iris diaphragm. And that is something that, will provide you with either more or less light. And then you see the little screws on the side. That allows you to take your condenser up and down. And then there usually are 3 screws there that help you to make sure that the light is centered. So if you look at the diagrams I have in the lower left there, you can see that in figure 1, man, that is just not optimal illumination. That light source is out of whack. So you have a figure 2 where you're starting to sharpen what it looks like, and then we're going to move it into the center, and then you can open your field diaphragm back up. And I do have a video for you to watch. It just makes it easy. This takes about 2 minutes to do. So you want to see those tiny bacteria. If we don't get really good resolution, I think it's hard to tell the difference between cocci and rods if we don't have a good light source. So we're going to put your favorite slide, some slide on the stage, and you're going to focus it as you would ordinarily. And then once you get it focused, you're going to take that little field diagram at the bottom and close it until you have about 2/3 of the sample illuminated. And that's what you're seeing in figure 2 and figure 3. They've gone even smaller than that, but you want to get the light down so you can see the edges of that octagon. And then you're going to focus the condenser to make it sharp. And the way you do that is you use the little knob that allows you to take the condenser under the stage up and down until you get a really sharp image. And then once that happens, then you can open that field diaphragm back up. If it's out of whack, you want to make sure it's centered, and then you open that field diaphragm until it's just out of view. And then if you're a Kohler superstar, you take out one of your eyepieces and you close the iris diaphragm down, that one up here, until about 2/3 of the sample is illuminated. So it sounds complicated, but I do have a video. So here's an example. At the Duke light microscopy score, you can see that the image on the left, as soon as you look in the microscope, you see that part of this image is black. And that tells you your condenser's out of whack. So in the middle on the top, you can see they've, sharpened that image, and then they're going to use their little screws to move it into the middle. So the image on the left, not good. After Kohler illumination, good. So now let's go ahead and we'll watch a video. And I'm not sure if you're going to be able to hear the actual audio, partly because my dogs are protecting me from Amazon, but partly because the video doesn't always come through. So I'm going to talk you through this, but you can at least see what this is like, and I'll provide you a link that you can go back to. So can you hear it?
No, the audio will
Okay.
not come through the GoTo
So
web.
of course, the first instruction is turn on your microscope. And then you're going to add your slide as we talked about, and get it exactly where you want it to be. And then you'll see, so she's projecting this on the wall so you could see. So put it on your favorite objective. So she's closing that field diaphragm down. And you'll see just a white spot there. And then you go to your condenser, you go up and down until you get it really sharp. And then you open the field diaphragm. So if it's out of whack, you want that light to be right in the center. And so you use your little screws as she's showing you to center it. And then you can open your field diaphragm. So if you haven't done this in a while, I will bet that when you go to your scope, it'll be totally out of whack. So here's the Kohler Superstar. You take the eyepiece off, you look down in there. So you take your little condenser thing and the little lever that's under the image, the condenser there, and you open it up. So I'm going to provide you a link to this, but I like to show it during the presentation just so you have an opportunity to see what I'm talking about. All right, let's go back to our all right, now that we got our scope all set up, we're gonna talk about derm diagnostics. And this is where I hope to make it a little interactive because there's a lot of you on the line, and I just want to answer some questions for me. So we're gonna get techie with our phones. There's two ways to do this. You can either have downloaded Poll Everywhere app to your phone, and where it asks you to type in a session, you type in my name, Valerie Fadock 074. It's not case sensitive. Or an easy way is just to go right to your text function on your phone. And where you would put in a phone number, you just type 22333. And then in the message section, you type my name, Valerie Fadock at 074. And then you should get, in a matter of seconds, a little gray box that tells you that you have joined my session. And that way you'll be able to answer questions anonymously as we go through this. It's really fun, so I hope you'll participate. So the first one is, what is your favorite dog breed? And we've got, of course, we see a lot of dogs with atopic, and apparently I've missed a breed of favorites. There certainly are a lot of good dogs out there, but gosh, golden retrievers, how could you not love them, right? And yet, they and Labradors are prone to atopic dermatitis. If you think about bulldogs, any dog with the name bull in it is prone to atopic dermatitis. So that's why we struggle with Frenchies and English bulls and pit bulls. Of course, Westies, they're the poster child for the terrier group. And then depending on where you are in the country, you might see shepherds or cockers, little white dogs, dogs with smushy faces like pugs, and Bostons and boxers. There's a lot of them out there. And these are the dogs we focus on a lot of the time when we're doing our workups. All right, thank you for that. And then the other question I had for you is, what is your job description? Are you a licensed veterinary technician? Are you a veterinarian? Oh my gosh, I didn't put veterinarian in here. How silly. Are you a client service representative? So yeah, to me, cytologies are and a derm workup are things the whole team can share. So in my practice, my technicians would often take the samples for me. Sometimes I took them myself, but they did all the staining and the reading. And if they had a question, then they were able to come to me. So one question I do see, oh, that's taken care of. Thank you. All right. Looks like we've got a mix. Some people are using the PCR. Quite a few people are still doing fungal cultures in their practices. So we can go over that. If nobody was doing cultures, then I was not going to review it. But it looks like it would be useful. And we've got plenty of good things to talk about. So thank you for that. All right. And what would you like to learn today? This is really an open-ended question, so you could type into your chat function whatever you would like to learn today. What is the most important thing for you to know? Because if I haven't thought to put it in the deck, I'll make sure that we address it. So practical tips for better techniques, we are totally doing that. What do we do with the results? Excellent question. Tape prep, we're going to go over that in detail because that's a workhorse. So, yep, we're going to go over sample collections for both cytologies as well as culture, and then tricks to remember identifiers of certain cells. Gosh, I wish I had a magic pill or shot. Maybe someday. And then, yes, how do we interpret fungal culture? And you can develop confidence reading cytologies. And if you would find it helpful to you, I am happy to make a PDF of the cytology slides I show you today that identify the cells, whether they're bacterial cells or clinical cells, and then you can use those as references. So yes, we will make sure that we go over all of these things. So good. I did a reasonably good job of planning, except for the magic pill or shot. So thank you. I have some great ways to provide opportunities for finding mites that don't involve skin scraping. So we will totally help you with that. All right. So let's move on then. We got a lot of stuff coming in. Cool. So our mantra is always going to be, this is why I love skin. Skin is on the outside and we can sample it. We can totally sample it. And this is a great advantage because we can biopsy it, we can scrape it, we can pluck hairs, we can use tape. We got a lot of ways to sample the skin. And the reason we do this is primarily to inform our diagnosis as well as our treatment plan. And then once we have our treatment plan in place, we use these techniques to follow therapy. And so very, very important, particularly for ears, that we're repeating cytologies. And so it's important for our clients to understand that one cytology is not the cytology that will last for the rest of the dog's life. A cytology is a snapshot in time, and we use it repeatedly as our most cost-effective test. So what do you need for basic derm diagnostics? We used to call this derm in a box because we did most of our work in our derm space, but sometimes I would go out and look at horses, or maybe I would go over to the exotics wing or help the surgeons or internists out, and they were always in a different place. So I could take my little derm in a box. You could set up a drawer in your exam rooms with this. It's good to have a flea comb. Good to have, a number 10 scalpel blades for your deep skin scrapings and your superficial skin scrapings, but I'm going to talk to you about a spatula as well. A pair of old hemostats that you can use for hair plucks. You want mineral oil and you want clear tape. You could use either the small strip Scotch tape. It really is a superior brand, or I like the packing tape. I can cut the tape to the size I want and fit it to the slide. You need glass slides, preferably frosted, because I know that I always forget sometimes what side I did my impression smear on. And so with a frosted side, at least you have some guidance. You want some swabs, cotton tipped applicators, culturettes, 25 gauge needles, and maybe clippers and clean blades and otoscopes and clean cones. Now, honestly, in my last practice, we went to disposable cones because of the issues associated with resistant bugs. That was a specialty practice, and when I was seeing ears, they were really bad pseudomonases that were resistant. So it was just easier for us to use disposables. But there are good protocols for cleaning your cones. You always want to use one per ear. Don't use the same cone in both ears, because you could have a unilateral otitis with an infection, and you don't want to spread that infection to the other ear. So that's kind of our derm in a box. Maybe you can think of some other things you'd like. We know that hand sanitizer and gloves have become more important than ever. This is Dr. Helen Powell in the days before COVID. So now we would see her with probably an N95 mask. And so you want to make sure that you are washing your hands or sanitizing them between all patients, even if you're wearing gloves. You want to sanitize your hands, and if you know you've handled a patient with a contagious, let's say you're handling a bunch of cats with M. canis ringworm, it would be a good idea to change your lab coat in between those patients too. And especially if you think a patient has MRSA, just really think about transmitting infections from patient to patient. So let's talk about skin scrapings and other techniques for mites. I am very fond of the other techniques. I've done a gazillion skin scrapings, but honestly, from doing this that puppies don't like them. And unless we warn the owner that the skin is going to look like a skin knee, they get kind of freaked out. So the way we want to do a deep skin scraping, we want to go for capillary ooze like you see here. We don't have to have frank hemorrhage, and we always squeeze the skin for a deep skin scraping. Why do we do that? Well, the mites like to cluster around the bottom of the hair follicle, and crazy as it sounds, when you give the skin a good squeeze before you scrape it, you actually compress those mites up into the opening to the hair follicle, and you just get better results. So, deep skin scrapings are always going to be used for demodicosis. These are mites on the left, as you see, that live down in the hair follicle. So what you're seeing, that red stuff, is the very surface layer of the skin, and the blue are a bunch of Demodex mites that are filling up hair follicles. Now on the right, scabies. Scabies is a more superficial mite. It doesn't go down into hair follicles, so we do superficial scrapings. That means you don't have to scrape till you get capillary ooze. I love these images. These images are made by a very talented electron microscopist called Dennis Kunkel. He has a beautiful website if you want to see cool things. So the sample on the right there, that's a scanning EM of scabies mites in human skin. And so you can see them, they're kind of coming in and out of their little burrows. You are never wrong to do a skin scraping. It is never wrong to look for mites in dogs. As a dermatologist, the test I almost always do is a cytology. I actually do fewer skin scrapings than I used to, but you're never wrong to do it. It is part of a good derm database. So what are the indications? Well, Localized demodicosis. We see this all the time in puppies, you know, periocular hair loss and redness, and you can see the redness around the muzzle in the lower right there. So the one thing to keep in mind when you're looking at Demodex, you know, allergic dogs can have redness around their lips too, but see how demarcated this is? It's like the front part of the upper muzzle has hair, and then we've got this very demarcated lesion. That is a real indicator that you want to be thinking about Demodex. And if your scrapings or your hair plucks don't find mites, then cytology and a fungal culture would be good. We might have generalized demodicosis. This is much less of a problem than when I graduated over 40 years ago. It was a really serious disease. We had nothing good to treat this when I graduated, and a lot of these dogs ended up getting serious deep pyodermas. But the hints for us that Demodex is there. Here you can see that this dog's got kind of a grayish bluish discoloration to the skin, and you can see papules and pustules and crusts. You know, this dog's getting a secondary pyoderma. And, you know, we may bring up, how do we call a dog localized versus generalized? Sometimes it can be hard, but we generally consider that if there are lesions on more than one body region, then that is considered generalized, even if it doesn't cover the whole body. So if you had 3 spots on the head, that's probably localized. But if you had a couple spots on the head and a spot on the trunk and maybe 1 foot, that's generalized. And so we treat accordingly. Sometimes dogs will have less redness. They'll just lose their hair and they'll have comedones or blackheads in their skin. But again, the key to success, that sharp demarcation. Pododermatitis. The one thing I would like to leave you all with is that if you are treating an allergic dog and then suddenly the dog gets deep pyoderma in the feet, if it's a Shih Tzu or a Terrier, you really want to look for demodicosis. These are breeds that tend to get adult onset demodicosis, and so they'll have feet that look like this. Now, most of us don't really want to scrape that foot, but we can do hair plucks, and we'll go over those. Scraping are some terriers you see that get this intense greasy seborrhea in a line down their back. There is a Demodex mite called Demodex NJ, and it seems to be associated with greasy matted hairs on the back, sometimes erythema, and most often in terriers. So what are alternatives to the blade? You know, one of the things about using a 10 blade is that we have a chance of cutting that animal if they jump. And so some people like to use these spatulas. These are regular old chemical spatulas that are used to scrape the skin. Now, I'm not going to lie, I find that these take a long time to get down to capillary ooze, and you have to press, and a lot of dogs don't like that. So if you still like the idea of a scraping, but you don't want to use a blade, in the right there, that's actually a bone curette. And if you pass that over a lesion once or twice, you're going to get a lot of good material, and it's very, very fast. It's very sharp, but it's very fast. So when we know they're in the hair follicle, we're going to give that skin a good squeeze, and then we're going to put oil on the skin. I put it on my blade and my slide as well. And again, the goal is capillary ooze. And then we're going to, you know, wipe that mush on a slide. We're going to put a cover slip on it, and then we examine it. I examine all of mine at 10x. It's because I don't have good eyes. Some people are really good at recognizing Demodex at 4x. If you have a question on 4x, you can always go to 10x. So I personally prefer hair plucks. To me, plucking hairs for demodicosis is my go-to technique most of the time. If you look at that husky puppy, none of us want to get close to that eyeball with a 10 blade, because he was goofy. And some of these really painful feet, you know, we kind of have to squeeze the feet to hold them still, and they're already painful, and the skin scraping is painful. So what we've learned is that hair plucks can be just as effective as a deep skin scraping and much more pet friendly. Because the good thing about it is that if they have Demodex, those hairs are going to come out very, very easily. And this is what the image would look like. So you just take your hemostats and you pluck the hairs. You want to get more than one or two, but usually it's easy. You know, get 10 to 20 hairs, and you lay them in mineral oil just as you would your skin scraping, cover slip, and then look for mites. And so what you can see on the left is that we have a beautiful collection of mites. They kind of stick to the hair. So when you pull that hair up, the mites come out with them. And in this example, we've got a couple of adults, we've got some larvae, and sometimes they'll swim away. So you'll see them close to the hair follicle, but not right next to them. So this is a great technique, and it's my go-to. I will only do a deep skin scraping now if it's on the trunk or abdomen where, you know, the nerve endings are a little lower, or I really believe the dog has Demodex and I haven't gotten it with my hair pluck. So think there's another technique that utilizes clear tape. You take that same clear tape you use for your cytology, and if you have a lesion like this, we call this squamous Demodex. It's erythema and alopecia, but not a lot of pus. You just put that tape down on the skin, and you squeeze the skin into the tape. And when you take it off in the lower left, you can see there's a little bit of cloudy material. That's all that sebaceous debris. And then you lay that in mineral oil and you examine just as you would. So to me, deep skin scrapings have kind of gone away, except for you know, certain circumstances. To me, hair or possibly this tape prep is good. So, you know, one of the things I learned when I was younger is that we know that Demodex mites live on all mammals. They have been found in all species, including us, but in low number. So what I was taught in vet school is that if I were to do a skin scraping on a dog and I found 1 or 2 mites, that might just be normal. Now we know that that is not true. The skin scraping is simply not sensitive enough to pick up the very low numbers of mites that live on the skin of a dog. So the only way that we can identify mites in absolutely normal dogs are by PCR. So in this particular study, they took 78 normal dogs and they did hair plucks, and they only found 1 positive sample for the long-tailed mite, D-NJ. So if you find a mite and the clinical lesions are supportive of demodicosis, we treat these dogs. You don't have to find a lot of mites, and if you find any, it's clinically relevant. So the key to success when you're doing your microscopy is you really want to, I've just told you how to color illuminate for cytology, but that makes your skin scrapings much too bright. So all you have to do to get a really good sample is to, a sample observation is to lower your condenser and maybe turn the light down a little bit. So these samples side by side represent the cytology setting on the left, the mite setting on the right. Now, I know the mites are there, so maybe you would say, oh, I can see the mites on the left. But look at the right, how clear and crisp these images are. These little animals don't have any color to them. So in order to see them, we really want a low light and low condenser. And then you're going to develop your systematic way to examine your slide. How you do it is up to you. But, you know, sometimes if we're looking for 1 or 2 mites, like we often are with scabies or chlamydia, you really have to screen that whole sample. So I like to start at the upper left and I just go back and forth until I get to the bottom. And then I know I'm not going to miss anything. So that's your some beautiful examples of Demodex canis. You can see the adults, they have 4 legs. The larvae usually have 3 legs, and then the beautiful little football-shaped eggs. So again, one finding is enough for a diagnosis. And here's a couple more close-ups of the eggs and a teeny tiny little larvae that's probably just hatched out. So Demodex NJ, we talked a little bit about being the unusual Demodex that we find on the dorsal surface of greasy terriers and sometimes other dogs too. And you can see that compared to a regular Demodex, this guy has a really long tail. Now we treat it the same. And sometimes we find Demodex canis and Demodex NJ in the same patient. You can see how long that is. And here, Dr. Robson has done a biopsy in the middle. And the really dark pink stuff is the cornified material, and the sort of a balloony looking things with purple dots, that's the sebaceous glands. But right inside that hair follicle, you can see mite images. Now, we shouldn't have to biopsy a dog to find Demodex, but sometimes we have to, because in particular, this mite can be difficult to find. So you can see the mites in there. Now, Demodex canis is the mite we see the most frequently, and for a while people were talking about a different species, which was a little stubby-tailed mite, like we see in cats. But now we know from genetic analysis, people have actually analyzed the genome of Demodex canis and NJ and this short mite, and we know it's just a variant of the regular mite. The long-tailed mite is a different species of Demodex. So all mammals have these. It's only a very small subset of mammals that develop disease, and for reasons that are not always apparent to me, dogs seem to be the species that we see demodicosis in most frequently. So based on what we just talked about, are you willing to try hair plucks for finding mites? Does this look like a good way for you to go? Honestly, for puppies and client satisfaction and speed, it's the way to go. So I hope that helps you. You can practice doing side by side if you have the time, but most dermatologists have gone to the hair pluck because we all like the fear-free approach, and this kind of helps us meet that. So what about superficial scrapings? And sarcoptic mange is one of the diseases that we're going to do it's one of the diseases that we tend to underestimate. So we want to be super vigilant for it. And here is a good example. Once we finish the mite section, I'm going to stop so that we can talk about your current questions until we move on to the cytology section. But superficial scrapings are different. When we do a deep skin scraping, we're usually scraping one area until we get capillary ooze. Here, we want to get as much material as we can. And this patient here, this is Abel, and I met him in Colorado. They don't have cat fleas in Colorado, so most dogs still aren't on annual ectoparasite control. And so Abel presented with this disease that's a little unusual distribution for scabies. If you look at his head, you can see his face and his ears are totally normal. So if you were to do our funny little pinnal-pedal reflex where you scratch the edge of his ears, he's not going to itch. But look at how red his belly is, and he's got crusting on his hocks. And so when you tickle his belly, he scratches like crazy. This is an example of scabies. And this is, he's very uncomfortable. I'm not going to diminish what he's experiencing. He's certainly not as bad as dogs like this that have had scabies for a long time. So, we look for ear margin disease, but don't ever rule out scabies by not having the ears involved. So here's a question for you. Let's say we scrape Abel and the skin scrapings are negative. Have we ruled out scabies? Absolutely. We never rule out scabies without the benefit of response to therapy. And you know, in the old days, the old days before isoxazoline, sometimes I would have to take dogs off their topical flea control and switch them to Revolution to rule out scabies. But now we have isoxazolines. These are 21st century ectoparasite controllers for dogs, and they have absolutely rocked my world. Made, you know, just treating everything we do in the skin so much easier. We'll talk a little bit more about them. Now, Chlamydia. Chlamydia, it's funny, it occurs in different parts of the country. I practiced mostly in Florida and Tennessee before I moved to Colorado the first time. And I had never seen Chlamydia. And I was asked, I was doing a working interview, and my future boss, Dr. Linda Messinger, said, "Hey, do you mind holding this cat with miliary dermatitis?" And I had long sleeves on, and I had, you know, lab coat, and I held that cat for 5 minutes, and I got infested with Chlamydia. So very itchy, contagious to people. But here's the thing: while it is contagious to people and to other pets in the household, the other pets may or may not be affected. So we usually associate it with a lot of scale, often on the dorsal back. And it's a variable itch in different dogs. We call it walking dandruff. We see it in cats. We can see it in rabbits. It's a problem. And then the other reason we might do a superficial scraping is lice. Now, again, lice I only saw on goats and cattle and occasional horses when I was in the Southeast, but we saw lice on dogs and cats all the time in Colorado because of the lack of ectoparasite control. So you can do superficial scrapings. I mean, if you see the mites or you see the nits, you've got your diagnosis, but you can scrape. And then cats. Notoedric mange in cats is the cat scabies. Interestingly, although it is possible for dogs to transmit their scabies, sarcoptes, to cats, it doesn't often take. So most cats, their version of scabies is notoedries, and it's very regional. You know, it's kind of in Florida and the more tropical parts of Texas than where I live in Houston, although we can see it here. And it causes crusting and itch on the ears, head, neck, and paws of cats. So another reason is Demodex gatoi in cats. Now, unlike the other Demodex in cats, which is a hair follicle mite and much less common, Demodex gatoi is a surface mite. And that's why we do superficial scrapings. It causes, for the most part, a non-inflammatory alopecia. So this is one of the rule outs that we use when we see over-grooming in cats. And often the alopecia starts on the belly, but it can become much more extensive. Now, here's the thing about scrapings for Demodex gatoi. We only find these mites 60% of the time. You might be better off finding them in a fecal, but honestly, we rule them out by treatment. Now, in the bad old days, treatment was lime sulfur dipping every week. Now, we just use an isoxazoline. So that's awesome because we know it'll kill this mite. So we're going to scrape over a wide area. That kitty there is my friend Fisher, and he's been on glucocorticoids. He has to take prednisolone every other day for his inflammatory bowel disease, and as a result, we just really struggled with getting rid of the Demodex. He couldn't tolerate lime sulfur, and he was living on ivermectin every other day for a year when I met him. So this is where, you know, your Revolution Plus or your topical Bravecto for cats really comes in handy. And I just want to show you what this mite looks like. It's a little stubby little guy, but the egg is different from the, you know, the follicular mite, which is shaped like a little football. This looks more like a little egg. And so if you see those in your scrapings, that's Demodex gatoi. So just to review, which of the following is not contagious to people? Absolutely. So sarcoptes we know is, and it causes tremendous itch in people, Chlamydia, and notoedries. And interestingly enough, even ear mites, if an animal has a really high amount of ear mites and it's causing body mange in addition to ear disease, even otodectes can create itch in people. So lice are species specific. You don't have to worry about that. So these are the contagious mites. So lice and Demodex are not, and that's a good thing. So the technique, we put oil on the skin, we scrape it broadly, and we examine it just as we would for Demodex. Here we see an example of a female mite with an egg in her belly. And then in the lower left, you see eggs, and those little brown nuggets you're seeing are actually scabies pellets or Sarcoptes pellets, fecal pellets. So if you find those, you can make a diagnosis of scabies. All right, we can often find these superficial mites with tape, and this is a lot kinder to cats. A paper has documented that. So when we're looking at Chilidiella, we're looking for those hooked mouth parts. They also have eggs. Sometimes the eggs are glued to the hair, but not like a louse egg is glued. So just the tip of the egg in Chilidiella is glued to the hair. But these mites are very large. To me, they kind of look like a saddle, and they have those big hooks. Here's an example again of superficial scrapings from cats, our beloved little Demodex gatoi, which causes cats to be itchy and is contagious among cats, I might point out. Not contagious to people and dogs, but contagious to cats because it's a superficial mite. And then cute little Notoedres cata. These are what the lice look like. Dogs have one species, or this is the sucking louse of the dog, Linignathus setosus. This is what we used to see a lot of in Colorado. Cats only have a chewing louse, and dogs have Trichodectes canis. So the one thing you may see on scrapings that you don't want to mistake for an organism are pollens and sometimes fungal spores. So here we've got an example of ragweed and pine pollens, but on the lower left, that's actually a ragweed pollen in a fecal. So you can see a lot of whipworm eggs there, but I mean, to me, that ragweed pollen looks like it could be a roundworm egg, but it's different. It's a lot smaller. So keep your eye out for that. And these are actually fungal spores in the skin cytology. So they will take different color stains, and we'll talk more about that. So what has changed? We have reduced our need for skin scrapings a lot when we use isoxazolines. We will always rule out ectoparasites, especially the superficial mites, based on response to therapy, because we don't always find them. And what could be better for demodicosis than an isoxazoline? Now, these are considered off-label uses in the United States, but they're the standard of care. So we have 4 different brands. Because I mentioned our brand, I have to share the important safety information. And you know, the nice thing about Simparica Trio, unlike what I call Big Boy Trio, is we can utilize Trio in puppies as young as 8 weeks of age, and it'll cover all of these parasites. So nice way to start puppies out. And for cats, we have Revolution Plus, as you know, gives heartworm protection for cats, which I think is absolutely critical. We're recognizing more heartworm disease in cats than we knew were available, and we can control fleas and ticks like we never have. We can control ear mites, roundworms, and hookworms. So before, I just put this up as a title. You don't have to type it into here, but if there are questions, then I would love to hear what they are. If you've typed them into the chat box, you don't have to repeat them, but maybe some things are occurring to you now.
Hey, Valerie, are you able to hear me, or do you want to read the question yourself?
No, why
Okay,
don't you read it for me, because I'm not sure I'm seeing them correctly.
Yeah, that's fine. The first question was, what do you use to clean your lens?
I use that sparkle spray. It's very inexpensive, and it's not going to etch your lenses at all. Now, if you have another lens cleaner approved by the makers of your microscope, then that's fine too. But I really like the sparkle.
Okay, and is there any comment about using alcohol to clean?
I would never use alcohol in a lens. It'll etch it, and it makes it last much less long than it should. So you want to use sparkle or something. So we got some good questions rolling in. I do believe in dulling the scalpel blade. You know, in the past, before we had methicillin resistant staph, we would just use the same blade over and over again. Now I would use a clean blade every time. So yes, you would want to dull it, but don't use the counter of your practice to do that. You know, you can get a little pumice stone or piece of wood. And yes, it is a good idea to dull it. Impression spears for mites. Gosh, you know, if you've got a dog with Demodex and it has a deep pyoderma and you express pus from it, you can totally identify the mites in your exudate. And if you find it on cytology, you don't need to do a skin scraping. You've got it right in your cytology. So which isoxazoline is safest for cats with mites? Well, we have both are safe. You know, we have Bravecto topical and we have Revolution Plus. Both of the companies have done extensive studies to show safety in cats. There is the neurological warning on both of them because that's, we do know that in a very rare case that some cats could have a neurological response to any isoxazoline. So it could be mild like a tremor, it could be more severe like a seizure. But the happy news is that these events tend to be very, very uncommon to rare. And so the next question I see is for hair plucks, do we add mineral oil? You know, I don't put oil on the skin for hair plucks. I just pluck them, but you definitely want oil on your slide so that you can lay the hairs in there, you know, the root ends in the oil, and then you can cover slip it so you can read the slide. So don't need tape, just, you know, pluck those hairs, lay them in your drop of mineral oil. You want the roots in there, and then cover slip them, and you're good to go. And then looks like the last question is, do I have to increase the frequency of treatment with isoxazolines in severe Demodex cases? You know, the beautiful thing, all of the isoxazolines we have in the United States, the companies have published papers to show that we can use them on label. That's helpful to us because, as I said, it's off-label to use any of them in the United States for Demodex, although we're unlikely to get in trouble because it's the standard of care. But we know these patients need excellent flea and tick control anyway. So I use an isoxazoline. If I'm meeting an atopic dog for the first time, I'm going to go ahead and talk to these people about you know, our plan, but I'm going to tell them, you know, I'd really like to make sure that fleas are not a problem here, but that I'd also like to rule out the possibility of scabies. And then often you can talk them into flea control where they won't, sometimes people don't like flea control. So I call it ectoparasite control. And that way I will never miss a scabies. So a general rule, you know, it really depends on the patient, but what we know from publications with regard to Simparica, I know that the dose needs to, for demodicosis, we need at least 3 monthly treatments to get to 100% mite free. For Bravecto, it's 1 dose. Must give with food. Be sure you give your Bravecto with food. And NexGard would require the same as Simparica, you know, 1 dose every 30 days. So I don't like meds that you have to give with food because people forget them. So yeah, for scabies, our paper and the ones that have looked at Demodex have shown you want to give at least 2 monthly doses of a monthly product or 1 dose of Bravecto, again with food. So very, very effective. And even though we don't have a lot of papers published, there's been a lot of off-label use of each of the isoxazolines. We know they kill anything that crawls on a dog or cat. So it's going to kill Chlamydia, it's going to kill lice, it's going to kill ear mites, it's going to kill even nasal mites. And then the website, the Great Electron Microscopy, I'll go ahead and send you a link on my hyperlink. Bravecto needs to be given with food because the difference in absorption is huge. So if you do not give it with food, you will not get the blood levels you want to be able to get that good 12-week residual activity. Okay, we always have more time for questions, but let's jump into cytology.
Valerie, we have a couple more that are on the chat box too that I'll just ask you. I think you got the cytology with the slides. How common, I don't know if you can comment on this, this is an exotics question. How common is it to find lice on rats?
Lice on rats. I did actually used to have a small rat practice when I was in my younger days. I rarely found them in pets. And honestly, in my later years, most of the rats that I worked with were laboratory rats, and they were kept in such pristine conditions. We never found ectoparasites on them. So it's a possibility, but I think you're more likely to find mites rather than lice on rats. You know, unless you're in a really large, almost like a herd situation and they're stressed. You know, lice tend to like stressed animals, and that's why we see them in young puppies and older animals. And then, you know, in cattle when they're crowded in the winter or come into a feedlot, that's when we tend to see those.
And then there was a question about reading slides and identifying other stuff besides bacteria, rods, and yeast. I know you mentioned the NASA learning presentation. Is that the best site for them to go to, or are there other resources you would recommend for identifying other things that you're seeing on the slides?
I'm going to show you some of those things in our next part of this. So if you feel like you need to get up and take a break, you know, go for it. But we'll look at different cell types, and then you'll be able to have a record of this. The other thing I'm going to put in the PDF, which I didn't think to put in this, is I want to give you some references to three really good books for you on derm techniques that have images of cytology in them, so you can use them in your practice. But what I show you today, you will have in the PDF. So we'll go over that.
Okay. And then this, you mentioned this, but regarding mineral oil, did you say you apply it to the skin prior to performing a scrape with the blade or spatula?
I squeeze the skin first, and then I put oil on the skin and the blade. I'm not going to lie, I'm a messy person, and I would rather have more oil than not enough. And I just find when I have a lot of oil on the skin, the blade slides over it a little easier, and I'm less likely to cut the patient.
Okay. And then do you have somebody asked about using is NexGard better with food too?
No. So the two brands that need to be given with food are Bravecto and Credelio. Neither NexGard nor Simparica need to be given with food, which is why, you know, I before Simparica I started with NexGard, and you know, now I really like Simparica. I know when my own dogs were trying to take Trifexis, I never could remember the food, and it's just hard for some people. So.
Okay, and then there's only two more I have in the chat box. Doing a deep skin scrape close to the eyes or other sensitive areas, would you recommend doing a hair pluck instead?
I would totally use a hair pluck. That's an area that really scares me. And so what I do is, you know, I kind of cover their eyeball with my hand, and I leave the eyelid area a little exposed, and I just take my little hemostats and just gently slide them over, grab my hairs and pull. And if it's really Demodex, the hairs are going to come out very easily, so the animals don't jerk like they do when you scrape them. So I never scrape feet or eyes anymore.
Okay. And if they use products like Simparica, how often should they scrape to check if treatment is effective?
Well, you know, we used to say that we would do skin scrapings every month. Now, what I evolved to in my practice when I was using isoxazolines is I just said I would ask them to come back after 2 months. And if I still found mites, you know, we would make sure they got another dose. But I almost always talk people into staying on the isoxazoline because they need the flea and tick control anyway. And then the mites don't come back. So I have to tell you my bias. You know, most of the Demodex dogs that I see are dogs that are referred because they're not curable. So I don't think we need to see them monthly anymore. You know, you could go as far as dispensing a 3-month course, have them come in 3 months, make sure it's gone, and then say, hey, let's just stay on this because we don't know if the mites are going to come back. And oh, by the way, you'll get the best flea and tick control you've ever had.
Okay, cool. Thanks, Dr. Videk. That's all we have for now, so we keep moving.
All right, let's jump into our cytology because this is our workhorse tool. And we go, here we go. We are doing this primarily to identify bacteria and yeast in the skin. And as I mentioned, you know, this is not a one-time test. A lot of clients, I love when I would get referrals. Oh, my veterinarian did a cytology 2 years ago. It's like, well, so if you need to explain it to clients, say, this is like a picture in time. And when your child grows, you know, you don't come back to that old picture and say, this is what my kid looks like, you know. So it's an image in time. And so we can use these tests not only for diagnosis, but for treatment. So indications, you know, clients, when their dogs have infection, they're not going to use our fancy derm language, right? They're going to say my dog has a rash, or my dog smells bad, or he's got these scabs all over him. So these are our indications. So boy, that little dog on the left, that dog's got malassezia. Look how brown that hair is. And then the dog on the right, that dog has a pyoderma. So these are dogs that we want to do our cytology. Now, I just told you that dog on the right has a pyoderma. So if I know it has a pyoderma, why do I want to do a cytology? Well, I want to make sure, in fact, that it is a pyoderma, because there are some other diseases, admittedly more rare, that can look just like pyoderma. So I want to make sure that I find bacteria in these lesions. And I also want to make sure that if yeast is present, I know that too. Because if I put that dog on antibiotics and there's a lot of yeast, he's not going to look like he's getting better very fast. So that of choice. And you want to have a clean microscope. You also want to clean your diff quick jars every week, sometimes more if you're really doing a lot of cytologies. We talked about oil immersion, and then I am a person without patience, so I do like using a hair dryer to blow my cytologies dry quickly. You don't want to set it on hot heat, but just, you know, the low heat, just it kind of blows the water off. And that can be helpful. And then I believe in matching the cytology technique to the lesion that you have. So certain techniques work better for certain lesions. If you have a nice juicy pustule, like you've got there, you want to take a 25 gauge needle and open that, or even the edge of your glass slide, and then you'll release that beautiful pus and you can do an impression smear. Tape is great for almost everything. It's going to work for feet, for facial folds, for around the perianal ring, for the body, even for the lip. The only time it doesn't work great is if you have very wet lesions. So I wouldn't tape a pustule or a hot spot. And then if you have very, very dry lesions, like a really dry crust, it's hard for tape to pick that up. And then I'm going to talk to you a little bit about a nail bed prep that you can use. So again, impression smears for moist or sticky lesions. We can use a 25 gauge needle, pop that little pustule open, and just, you know, I take my slide and I press it multiple times along the length, because usually if it's a pustule, it's going to be too thick with the first application, but then the more you press it, the thinner it'll get. And then a dog like this in the lower right, that's one of my bulldog atopic patients with a hot spot that's, you know, eating New York City. And so tape isn't going to work quite as well for this, an impression smear will. So here's if you really love your cytologies, Dr. Jimmy Noxon is at Iowa State, and he's a grandmaster. So if he gets a pustule like that, you know, and he's got a blob of pus on the slide, he could do a squash prep or smear it. But what he really likes to do is take a fine paintbrush and paint that pus out. And his rationale in doing that is you get much less destruction of the cells. So on the left, you see a squash prep, and you see a lot of like purple ribbons or streams that run through there. That's DNA from neutrophils that we have ruptured. And this is actually from a patient with pemphigus foliaceus. And so it's kind of a mess of a cytology. It's on low power, but look how beautiful if you use the paintbrush. All your neutrophils are intact, and our acantholytic cells, which are rounded epithelial cells, look beautiful. That's just taking it up a notch. So you can also scrape. Now here you could kind of see some oil. You don't want to use oil for this. You can, if the lesion has some moisture to it or some greasiness, you could just take your dull blade or your spatula or even the edge of your slide and just scrape some of that material off and smear it out on the slide, and you can get good results that way. But tape has been a power horse for a lot of us because it's fast. I like it for around eyes and feet. It's great for folds. You know, if you try to do an impression smear in these areas, you often break the slide. And it's good, you know, for perianal lesions. A lot of times malassezia likes to live around there. But if the lesion is either very wet or very dry, the results are less optimal. So we can press it between toes. I like the single-sided clear tape. And again, you can use the strip tape, but I like the packing tape. I can cut it to the size I want. So here's Dr. Dana Liska illustrating the strategy. So here's a little beagle. I'm willing to bet that beagle's got malassezia, maybe staph too. So she's pressing the tape on the skin. And here it is. She likes to attach hers to the end of the slide for staining. I just use a clothespin. But you can see, look at all the good material we've grabbed up there. You know we're going to have good results with this. And then we're going to stain it. Now, the most important part about the tape cytology is do not dunk it in the methanol fix. That's number one with your diff quick, because what will happen is the tape will kind of cloud up and it just makes it harder to read. So you don't want to use that. If you like the dipping technique, you can dip it multiple times in your pink stain and then your purple stain, and you get the pink as a counter stain. But, you know, so then we're going to rinse it. Again, here's a clothespin. We rinse it. You can rinse it from the tap water. It's stuck to the tape. You're not going to rinse anything off. And then you're going to take that tape and you're going to put it sticky side down on a slide and squish out all the water with paper towel. And then you're ready to go. And this tape can actually serve as its own cover slip. Now, what you want to remember to do is remember where your fingers were. And so if you look closely in the lower left of this tape, you can see the fingerprint images. So when I'm going to look at this slide, I'm going to go up in the upper right there where I'm seeing, you know, no fingerprint images and just material, brownish material that looks like I got it from a beagle foot. And then you're ready to go. Now, here's an easier way, and I really like this way. I learned this from Dr. Schuett. He's in general practice in Pewaukee, Wisconsin. And as he'll tell us, he never does this. His techs do it, and they do all the reading. But what they'll do is they'll take a piece of tape, and they'll put it on the foot or wherever on the body they're taking a cytology, and then they turn it upside down and stick part of it to the underside of the slide, and they lay a thin ribbon of just the purple stain on the slide, and then you flip the tape over so that the sticky side is down, and you can squish out any extra dye and you're ready to go. This is really fast. So if you don't have time for dunking, this way works just as well, and it's become my preferred technique. So we can use swab cytologies. You know, if you have feet that look like this, these are very yeasty feet with a lot of that greasy, waxy exudate. You can roll a swab around in there. I love them, of course, for facial folds, bulldogs, Frenchies, pugs. You can get in there with a swab, treat it like an ear. You know, we all do swab cytologies for ear. The key to success is to roll it and not to scrub it back and forth. So when we roll the swab over, we're able to, reduce the trauma to the cells that may be in there. If we scrub that swab back and forth, we're going to rupture cells. And I usually use one slide. If I'm doing an ear, you know, the left ear is always going to be closest to the frosted part, and the right ear is going to be closest to the end of the slide, and that way I know what I'm looking at. Now, the question often comes, you know, when we are doing ear swabs especially, should we heat fix it? A lot of us still heat fix, even though one study showed us that heat fixing wasn't necessary. So you can heat fix it by, you know, passing a big flame under it briefly. You know, we don't want to boil the sample, but just briefly, and then you can wipe that black stuff off. Or some people like to use those old coffee warmer plates, and that does a nice job too. And then we're going to stain this. So here is one of my favorite techniques for dry crusts. And I used to do a lot of horse work when I was younger, and this was how we identified Dermatophilis, the rain-scald organism in horses. If you have say a Westie like this crust is really dry, and you may do a tape cytology and not find much, but you're worried, you know, is this really a pyoderma, or maybe this is pemphigus or even cutaneous lymphoma. So what you can do is just pick that scrub off the skin with a hemostat or whatever you want to use, and then put it in some saline on a glass slide and just chop it up with one of your old 10 blades. And then I blow dry it, and you knock the big chunks off and you put it through your stain procedure. And then what you'll see is something that looks like this in the upper right. We see lots and lots of cocci here. And I know they're cocci and not just artifact because I see doublets, and we'll go over that more. Now, you're not going to see a lot of neutrophils because it's a dry lesion, but that doesn't matter. This is still a significant cytology, and then we know we need to treat this dog for infection. So Malassezia on nail beds, Jimmy Noxon likes to just use a toothpick, one of those toothpicks. You can do a very gentle scraping up under the nail. So I like to take just a little piece of tape. I don't usually have really long fingernails, so I'll just tuck a little fold of the sticky part up under the nail bed, and you'll see a small amount of white stuff. And then, you know, you just put your stain on a slide and lay that white patch right there, and you're good to go. So I think it really is important to recognize yeast in nail beds, because we know that this can be a reason why some dogs don't do as well on Apoquel or Cytopoint as we would like them to. So the diff quick stain, we've already talked about changing it weekly. When you're doing your impression smears or your dry crust preparation, or your tape prep, not your tape preps, your swabs or your nail bed stuff, you want to use all three of these. You want to use that fix. But if you're using tape, just skip the methanol fix. You don't need it. And in fact, it'll make it hard to interpret. We don't want to go straight to oil, because when you go to oil, man, stuff it can be really hard to find. So you want to go to your slide and look where you see clusters of cells, because often bacteria and yeast like to stick to these cells. So, I'll scan it at 10x, and, here I've circled an area I'd like to look at. And then when I go to oil, I see all these yeast buds that are sticking to the keratinocyte. So what we're looking at here, the little round purple things, that's our yeast. But these other large cells are actually sloughed skin cells. So those are keratinocytes. And they're the place that Malassezia and sometimes bacteria like to stick. But the other reason to scan at 10x is illustrated to the right. And we talked a little bit about, could you find Demodex in a cytology? You absolutely can. So this is from a dog with a deep pyoderma. We squeezed out some pus, got a lot of cells in there, but you can see the image of the mite in there. And so I don't need to do a hair pluck or a skin scraping. I know this dog has Demodex. So most people would suggest, particularly if you're going to use cytology to monitor progress, that you set up some kind of record system. And it's a rough count, either 1, 2, 3 or 1, 2, 3, 4. 1 in this example is less than 10 per oil field. You want to look at least 10 oil fields. And then, 10 to 20, 20 to 40, and then 4 would be too numerous to count, or masses. So to me, that's too much counting. I never count more than 20. So I do a 1, 2, 3 system. It's kind of like a low, medium, and high. The reason you want to do this, though, you want to have an appreciation for the abundance, is because if your doctor or you do not see the patient for the recheck and a repeat cytology is done, you want them to know in the record about how many things you saw the first time, so that they can make a judgment whether the treatment is working. So in the upper right here, we see cocci. How do we know they're cocci? We see doublets and tetrads. Staph likes to buddy up with its friends, and so that's not an artifact. And what you're seeing in the background there are disrupted neutrophils. So we can't hardly tell they're neutrophils. Maybe this was scrubbed onto the slide, or the neutrophils were super fragile. So all that streaming purple stuff, that's DNA from your neutrophils. Now on the right, we see some intact neutrophils. We see this neutrophil here, it's a polymorphonuclear cell. You can see they've got some vacuoles, and then these are rod bacteria that we're seeing both in the cell and out of the cell. And then down in the lower left, our beloved Malassezia. So here's a few more examples. Something we might see from a pustule. You will see these beautiful, happy neutrophils. There's some DNA streaming, but at least you can identify the cells. They're beautiful. And we see lots of intracellular cocci, lots. So the immune system is trying to get rid of this. But if you find staph outside of cells, that's just as meaningful, because we recognize infections in dogs that just stay on the surface of the skin. And so we've got beautiful cocci here. How do we know a little purple dot is a cocci? You see them close together in 2s or 3s or tetrads. So then you know that that's a cocci. And they're not always the same size. Sometimes they're big, sometimes they're small, so it can get a little confusing. So you don't need to base it on size, just see if they're buddying up with their friends. Here's beautiful Malassezia. One of the things you may see that we've illustrated on the right are ghost yeast, and these are yeast that simply do not take up the stain. So often when you'll do a Malassezia prep, you have to go up and down with your focus a little bit to get the organisms in view. This could be a life stage, they don't take up tape, but if you are managing an atopic Westie like this and you only find a few yeast, that's still meaningful, because allergic dogs get allergic to yeast, and then even low numbers will make them uncomfortable. So other examples on the left, we've got the polymorphonuclear cell, we've got neutrophils or PMNs. This cell with the kidney-shaped nucleus here, that's a macrophage. These other cells with lots of cytoplasms are macrophages. And then you see clusters of cocci in different places. Here's a little bit of a close-up where we can see the doublets and these beautiful neutrophils and cocci. And this is probably the most common cytology you'll see if you have moist. Some other examples, we often see cocci mixed with yeast, and you know, our eyes want to go straight to the yeast, but you got to look around for those bacteria. And if you look closely here, you can even see a rod bacteria. It's about the middle of the slide, or the image, off closer to the right border. But this is primarily cocci and yeast, so that's what we're going to treat. And you can see a cluster, a little grape-like cluster there to the right. Now, this is a different kind of cytology. Often we will see female dogs, especially if they're allergic, develop perivulvar or vulvar dermatitis, and it's often very painful, and it's ulcerated or eroded. And often these dogs have Pseudomonas infections in their skin. So one of the things you'll notice in this cytology, you can see that the arrows are pointing to rod-like bacteria, but notice how different the neutrophils look. You know, we had happy, healthy neutrophils with staph, but Pseudomonas makes some wicked toxins. And so it makes the neutrophils look sick, and we see lots of broken neutrophils, and we're seeing a lot of that DNA streaming. That is very common when you have perivulvar dermatitis associated with rods. So this would call for a slightly different approach. In a dog like this, that is so painful, I would totally put this dog on a fluoroquinolone. We could treat it topically, but she's not going to let you touch her private area until we've gotten some resolution. So I would start with a fluoroquinolone, and then we can add topical therapy to that. Skin cytology, this is an example of what we call pyogranulomatous inflammation. And that just means pyo is neutrophils, granulomatous means activated macrophages. So those big cells you're seeing with the big nuclei and all the little, you know, holes in them, those are vacuoles, those are activated macrophages. And then we have neutrophils surrounding them. Now this cell up in the upper left here, that's actually a lymphocyte. So it's a smaller cell, and most of the cell contains nucleus. Now this is the kind of thing you would see more from an aspirate. You might see it. This is actually one of my dogs that I adopted. She has sterile pyogranuloma disease, and you can see there's kind of a hole in the lesion on her right foot there. So if I express pus out of that, this is the kind of cytology we would see. No organisms to speak of. It's a sterile disease. Recognize biofilm, and the most common place you will see biofilm is in dogs with chronic otitis externa that's been infected. Here I'm showing you an example of Pseudomonas, but keep in mind that chronic staph infections in the ear can do this, as can malassezia. Biofilm is all that purple stuff you're seeing in the background, and it's often associated with chronic Pseudomonas infections. So the neutrophils are toxic because of all the toxins that Pseudomonas produces, and you could see that some of the rod bacteria are inside that biofilm. Why it's important to recognize this is that if you have biofilm in an air, you will never treat it successfully unless we anesthetize this dog and wash all that goo out. Even if we put a super potent antibiotic in the ear, it will kill the bacteria that are not in the biofilm, but the biofilm protects the bacteria. So we have failure after failure. So these dogs need an anesthetic ear cleaning. Now, what about other cytologies? These are kind of fun. You know, if we have a pustule, 95% of the time it's going to be a staph infection. But what if you got a cytology like this? This is a case of pemphigus foliaceus, and we recognize it because we have happy neutrophils. Again, these are not toxic neutrophils, and you see all these large acantholytic cells, and acantholytic cells are skin cells that have just let go of each other and leaked into this pustule. So it's different from the keratinocytes we were looking at before. Those don't have a nucleus and they're sloughed. These are nucleated cells that simply can't stick to each other anymore. So if you see this on a cytology, you want to be alerted to the fact that, wow, this is highly likely to be pemphigus, and we want to confirm with a biopsy. What else would you see? Well, you might see eosinophils. And sometimes the eosinophils you see are inside, or the granules are inside the cell, or they're outside the cell. So in the close-up to the left, you can see that these cells they're a lot like neutrophils, except that inside you see all those beautiful little purple, pink granules. So this is from a cat, and some of those pink granules you see are outside the cell. That's from the eosinophils that have degranulated. So these are the kind of diseases you would see eosinophils. So if this is a dog with something we call eosinophilic furunculosis, this is usually insect related and it comes up very quickly. And if you were to make an impression smear of that moist lesion, you would see eosinophils, and you might see granules that are outside the cell. So this is a dog that really needs steroids to resolve that. And then on the right, you see eosinophilic plaque in the cats. So if you were to make a cytology of that plaque, you would find eosinophils. You'd probably also find bacteria, because eosinophilic plaques are often infected. And so we have to treat the infection, but we also have to treat the eosinophilic plaque. Other skin cytologies that you'll see, Simontiella. Simontiella is a cool bacteria that lives in the oral cavity and the pharynx. And so it looks like, oh man, this is really pathogenic. But the reality is it's associated with licking. And so when you do a cytology from a really wet foot that a dog's been licking, or sometimes around the skin folds there, you'll see these super large funky bacteria that are Simontiella. And you'll also see these other rods, because the mouth is just full of rods. It's full of, there's Corynebacterium in there, and there are Clostridia and all those things that, occur in the mouth. So that's not a pathogen. That just tells you the dog has been licking. Things that can fool you: melanin granules and cells. They can look a lot like staph, and they do clump together, but they are brown. So if they are not purple and they are brown, they are not bacteria. They're always associated with these keratinocytes. Sometimes they're outside, but this is not a bacteria or a pathogen. It's just a melanin granule. And then stain artifact. And this is one of the reasons why we would advocate for you being sure that you clean out your stains frequently, because this could look like, I don't know, to me that could be bacteria, or maybe even like a small branching fungus of some kind, but it's stain crystals. So you want to make sure you clean your stain. Other things you might see, especially in allergy season, you will see pollens and molds in your cytologies. So here's one that I pulled off Facebook. This is from the Canadian Academy of Veterinary Dermatology. And that's a pine pollen. They kind of look like Mickey Mouse ears. And so this is a cytology that contains no real pathogens that I'm identifying. These dark purple things are stratum corneum cells. They're slough cells. There's a lot of what we call schmutz, just all these different purpley things that might represent dirt the dog has picked up, but it's, they're not doublets or triplets. This is probably a little fungal spore here, although it didn't stain very well. So very common to find pine pollen, especially from feet in allergy season, and sometimes you'll find fungi. So this took up the stain a lot. Sometimes you'll see that these are slightly brown, and so we know no pathogen we look at is ever brown. Well, in rare examples, but not from a surface cytology. So in this dog, we do have a yeast bud here and maybe here as well. This is a skin cell, again, stratum corneum, but this is not a fungus. This is, it is a fungus, but it's not a pathogen. So it's not dermatophytes. And then some pollens. Sometimes they take up funky colors. I think they're really cool. These are at least the two to the left are ragweed. So cool stuff. All right, let's just do a couple of cases where cytology makes a difference. So, and then we'll open it up for questions. Atopic dermatitis is always a challenge for us. This was a dog that saw Dr. Malden at the University of Pennsylvania, and he's 5 years old. And you can see his history is he's always done well on cyclosporin and the combination of cyclosporin and ketoconazole. But then he broke out of control. And so whenever your allergy medicines stop working, you want to look for infection or a flare of ectoparasites. So the doctor said, well, let's just switch him to Apoquel and see what happens. And they put him on Apoquel and it didn't work. He's still really scratching at his neck. So you can see his neck. That's a bulldog neck. Sometimes Labrador necks look like that. So because I said the word Apoquel and it's written down, as you know, Apoquel is meant for dogs 12 months of age or older. So here's this cytology. We're seeing a lot of stuff here. So these big black arrows are pointing to little doublets, and these thin arrows are pointing to these organisms here. We've got big old epithelial cells. We've got, even if we look closely, they're not quite in focus, but we've got some yeast here as well. So I might have put a question. Oh, I already gave it away. That's what we see. So what I call this is the garbage can neck. This is the kind of cytology, and I often get from ears of atopic dogs when they have an acute flare. It's what I call the garbage can ear. So because there's a fold in the neck of these dogs, I call it garbage can neck. We got a mix of staph, and we've got a mix of rods, and we've got yeast, even though the dog's been taking ketoconazole. So, but this is surface infection. So you're not really seeing a lot of white blood cells. And what this is telling you is you can wash this away. We don't really need to use an antibiotic for this dog. The owner can wash that neck every day, and the dog will do much better on his Apoquel if we can get that infection under control. Oh, you guys were really good. Yeah, awesome. So here's another case. This is a 1-year-old Mastiff, and I'm sure you see Mastiffs or Bull Mastiffs, or, you know, sometimes Shepherds will do this, especially when they're puppies. They just break out with what looks like human acne. You know, they get these big pustules and papules on their lips and their chin. This particular dog has a recurrent yeast otitis too, but these are so much fun for dermatologists because we can take our needle and open these and we can get beautiful pus out of there. And this is what we see. So I have a question for you. Look at the red arrow. Look at what you see in the red arrow, but then also have a look at what you're seeing in the green arrow. So the green circle, I should say. And so what do you see in the red circle? Absolutely. And I realized actually, if we go back to it, if I look closely, there's a couple of rods in there. So if you wanted to pick rods, you're totally not wrong. So mostly coxy, but what is not a pathogen for us. All right. Now, I'm going to suggest we go right to fungal culture so I can give you an overview. It will spend 5 minutes at most because I do want to have some time at the end for questions, and I'll stay on longer, but I want to respect your time. So I set this up. I'm learning how to do hyperlinks. It makes me feel very smart. So do that, and we go straight to fungal work. So the first thing I want to tell you is any practice that sees cats and Yorkies should have a good woods lamp. And you want a woods lamp. You don't want to use a urine black light or you're going to get false negatives. So this Philips Burton UV 503 is awesome. Yeah, new, it costs about $500, but you can find them on eBay for a couple of $100. This is a great tool to screen cats and Yorkies for ringworm. Why do I say Yorkies? Yorkies are really susceptible to M. canis. M. canis is the only fungus we know that fluoresces. And so this to the left, this actually is a Yorkie. And that poor little dog took us 6 months to resolve that infection. So that's a good investment for you. You know, you let it warm up a little bit. And what we're looking for is not fluorescence in the skin, but fluorescence in the hair. So even if you see one hair like this, you know you've got M. canis in that patient. And these you can pluck for your direct exam or for your culture. You can get some false positives. So if people have been using ointments on the skin, sometimes you'll get a false positive, but those are rarely associated. So here's an example. Here's a new kitten. You can see that crusty lesion around the eye. Third picture from the right, that's positive fluorescence. Here's my favorite case, because this cat had this disease for 3 years, and it was characterized by, you know, waxing and waning hair growth. And the whole time, this cat's sleeping in the owner's bed, and the owner never got ringworm from this cat. And so this cat was referred. Biopsy was taken, and they missed a follicle that contained the ringworm. So they diagnosed it as perivascular dermatitis, which usually means the skin's inflamed and it's probably allergy. So the cat went on for another year having this disease, and I was going to rebiopsy her, but I pulled out my Woods lamp and look at all the positive fluorescence. So when you get a positive fluorescence, if it's authentic green hair, you've made your diagnosis and you can start your therapy right then. So, you know, screening kittens, you want to look at toes and ears and around the face. Those are the most common areas that you'll see affected. Okay, how do we collect samples for fungal culture? You can scrape hairs and crusts from active lesions, or if you have relatively asymptomatic patients, you can do the Mackenzie toothbrush technique. And all you have to do is get a clean toothbrush and brush it through the cat like you're grooming it. And then you gently embed the bristles into your DTM media. So this is where plate DTM works better than the tubes. You don't have to pull all that hair out and impress that into the media. You just gently embed the tip of the bristles. Now, how does dermatophyte test media work? Well, it has a pH change that induces a red color change when fungi use the proteins in the media first. So it turns alkaline. Now, most of the time, that's going to be a dermatophyte, but not always. So simply turning red doesn't mean you have ringworm. You do not want to use the quick media. Multiple publications have shown that you will miss a significant percentage of your cases if you're using Rapid Vet D or the Intray DM. So you really want to use, I like Hardy, but you can get other materials as well. And I like these plates. They're just easier for me to handle than the tubes. So if you're going to culture these, you need to have the correct culture conditions. And we've always said grow them at room temperature. But honestly, most clinics aren't at the ideal temperature. So you can buy a cheap little incubator on eBay and set it to 78 to 80 degrees. That's where dermatophytes like to grow. And then you put a pan of water in there to keep it humid. And somebody who loves fungology should be the designated person in charge, because you want to look at these every day. For dermatophytes, the red color will come as the colony grows. And most of them are going to grow within 5 to 10 days, but we usually save the cultures for 2 to 3 weeks. Keep in mind that even if the media is red, if the fungus is gray or green or dark brown on the top, it's not a dermatophyte. Dermatophytes are always white or tan. Then I think it's important to determine the species, because the species of dermatophyte dictates how we are going to treat this patient. These are biohazard, and so, you know, keep them covered and, you know, keep them in a place that is secure. So again, the red color by itself doesn't mean dermatophytes, but this is an early positive culture. You can see that white fungus is starting to grow and the red's there. A late positive culture on the right, that's at 14 days. Now, I know that's a dermatophyte, but if you just pull your cultures out after 2 weeks, they could be overgrown by contaminants and you might miss your diagnosis. So again, the red color change is not the diagnosis. You have to have the red color and the top of the colony, which is white or tan. So if we ask ourselves which of these is a dermatophyte, the one on the right has gray-green coloration. Even if the media is red, it doesn't matter, that's not a dermatophyte. The one on the right has got white on the top. What you're seeing, the color, the yellowish color through is coming from the bottom. So that's definitely a dermatophyte. And so here's some common examples. Here's little M. canis. That's the one we get from cats. We get it from dogs too, but that's our most common cat fungus and Yorkie fungus. And then trichophyton. There are a lot of species. This tends to come from rodents, and so we see like Jack Russell Terriers that have trichophyton on their face. These are associated with rodents and rodent burrows, and to me it looks like somebody's dropped powder on the surface. So the surface is always white. The bottom may be pigmented, but the surface is white. And then on the right we have M. gypsum. That is a soil fungus. It comes directly from the soil, so it's not contagious to other animals, between animals, or between animals and people. So treating is easy for that. The other two fungi are contagious to other animals and people. So to me, M. gypsum looks like a chamois. And if we want to look at the microscopy, you can take your clear tape and you can put a drop or two of your Diff Quick and just lay your tape on that. And then you can look for the spores. So on the left, we have M. canis. If we look at the close-up, it usually has thick walls and it has 6 or more chambers in it. Sometimes in early culture, you may not see all the chambers. You may just see this little canoe shape with a knob on the end. And this other stringy stuff, that's the hyphae. That's the vegetative matter. M. gypsum, some places you see this more than others. I see it a lot in Texas and a lot in Florida. It looks a little bit like M. gypsum, but the walls are thinner, as you can see here. And it has 6 or fewer chambers. So with trichophyton, what we tend to see are these little microconidia. So if you get a lot of these little spores coming up, that tells you probably have trichophyton. If, however, they have color, if they're green or brown, they're not trichophyton. So here are some common contaminants. You can see aspergillus. This often has a beautiful kind of broom shape, but see how they're little spores, but they're brown. This is alternaria. Some people worry that this is dermatophyte, but it's brown. So even though it has chambers, M. canis doesn't have a longitudinal chamber. It just has these horizontal ones, and it's brown. So I'm going to stop there. I want us to have a little time for questions. If you have to go, that's okay. I'm going to make these materials available to you. You are welcome to reach out to me if you wake up at 3 with questions, like sometimes I do. You are welcome to email me. But I'm happy to stay and answer any questions you have about cytologies and fungal cultures. Thank you, by the way, for attending. I'm really grateful to you.
Valerie, I can read to you a few of the questions that have come in. To start with, if they do want to reach out to you, what's the best way for them to contact you?
The best way is with my email, and it will be on the document that I send you. It is Valerie, V-A-L-E-R-I-E, .fadok, F as in Frank, A-D-O-K, @zoetis.com. And if for any reason you forget that, you are welcome to reach out to any of our colleagues. Thank you for that. There you go. And I'll make sure I put it on my document for you too. So, I know I think of questions usually after the fact, and I want you to feel like you can reach out to me because because I'm stuck at home and I'm lonely. so reach out anytime. And
Okay.
thank you for attending.
There were a few questions about reviewing certain slides again. My recommendation to that is Claire's going to release it doesn't list the slide number though, Valerie. So I think Claire will release the recording. So probably the easiest way is to go back in the recording that'll go up on the site and then rewind to that section and watch. And then if there's a specific question beyond that, Claire can reach out to us and we can help handle it. Valerie, the first question I have is, what about a heat source to dry a tape prep? Do you need to dry a tape prep, and is it okay to use a coffee warmer to quickly dry other slides?
You know, the nice thing is you don't need to dry a tape prep, because when you lay it on the slide, it's going to be a little moist, but you just squeeze out all the excess water with a paper towel, and that will get you where you need to be. So if we put too much heat on that tape, it's going to cloud it up too. So I like to heat fix just about everything except my tapes.
Okay, thank you. How can you tell macrophages from other round cells? Is there a quick tip that you have?
Yes, macrophages are always larger than neutrophils or eosinophils or lymphocytes, and they have a lot of cytoplasm. Many times they have a kidney bean nucleus. So I think what I'm going to do for my PDF for you is I will put some extra stuff at the bottom that specifically labels this is a macrophage. This is a neutrophil. This is an eosinophil. This is a lymphocyte.
Okay, thank you. Can you recommend a cleanser that's best to remove biofilms when a patient is sedated?
Yes, you know, the one I really like to use because it's safe if the eardrum is ruptured are those cleansers that contain squalene. So vetiquinol makes one, and Decra makes one. Decra's one is called Clear Odic. And vetiquinols, which is the one I use all the time, I'm having a senior moment. I'll put it on my handout. But if you go to vetiquinol and look at their, it's the one with squalene. I've used it for years. It's wonderful. What you do is you put it in the ear and you let it sit there for a couple of minutes and then massage the ear and then flush it all out with saline, or even water can be used, and all that goo just comes out of there. And then you remove enough of the biofilm that you can then instill your medications, and they'll actually be effective for you.
Okay. Best treatment recommendation protocol for yeast pododermatitis with pruritus or from feet licking.
So most of the dogs that have malassezia in their feet are also atopic. So there are a small subset of atopic dogs that are just allergic to yeast. And in those cases, managing the yeast alone gets them under control. But most of these dogs are going to need, if they're atopic, they're going to need something like Apoquel or Cytopoint. But in addition to the Apoquel or Cytopoint, we need to kill the yeast, because yeast-induced cytokines that Apoquel and Cytopoint were never meant to control. So there are a couple of ways to do this. You know, if you have a golden and they're easygoing, you know, people can use wipes on the feet. You know, Duxo makes some, Decra makes some. Those are really easy for people, and they're good for folds too. But if it's in the nail bed, that's really hard to treat. So what I do is I do use a systemic antifungal, any of the azoles at 5 milligram per kilogram per day, or terbinafine at greater than 30 milligram per kilogram per day. And we treat daily until the disease is resolved. So it could take 2 weeks, could take 4 weeks. Now, what if you have a patient who gets recurrent yeast infections in the nails? that suggests the patient is allergic to the yeast, and they'll bite their nails, and it's a common cause for what is considered loss of efficacy for Apoquel or Cytopoint. So what I do to manage those dogs is I put them on pulse antifungals. So if I've treated them with ketoconazole, I take that same daily dose of ketoconazole, and they get a dose of it 2 to 3 times a week. I start with 2 days a week, and if that controls them, great. Some dogs need 3 days a week. It's a low dose, and they have plenty of days off, so we're not really getting into trouble with our with the liver. And so that kind of pulse therapy can help your Apoquel and your Cytopoint work much better. And Malassezia hypersensitivity is common in atopic dogs. So if you're treating pit bulls, Frenchies, Westies, any dog that, even Yorkies. Yorkies, it's harder to see because their nails are dark and you can't see the exudate at the base of the nail. But if they're, if they're on Apoquel or Cytopoint and they're biting their nails, it's highly likely they've got yeast in those nail beds, and we can do a great job by managing that yeast.
Okay, thank you. What's the significance of a foamy macrophage?
It means the macrophage is activated and it is trying to phagocytose everything that's around it. So, it's trying to eat bacteria, and it's trying to, it's bubbling its membrane, and it's trying to, pull in anything around it so that it can destroy it. So it just tells you that, there's an active process going on. Now, with sterile pyogranuloma, we don't know why those macrophages get activated, but they do. They're trying to eat something that isn't a pathogen. We don't know. It could be just they don't get shut down correctly, but it just means they're activated and they're looking for a job.
Okay, cool. And do you have an opinion of fungal PCR? Is it faster and more conclusive?
That's a great question, and I'm happy to tell you that there are now at least 3 independent publications that show that the IDEX PCR is just as reliable, or maybe even more reliable, than a fungal culture. Now you get, any test is a test, so we know we're never going to get 100% efficacy, right? So you can get false positives with fungal cultures, you can get false negatives. Same thing with a PCR. The most common cause of a false positive with a PCR is that there's fungus on the coat, or maybe you've treated the pet and there's still DNA on the skin, but it's dead DNA. So the 3 authors who have published on this believe that it is good for making the diagnosis, but it is not good for following response to therapy. So if you're in a cattery situation, you're probably going to want to use repeated cultures to follow therapy. In a clinical situation, honestly, I often use my Woods lamp, and I wait until the fluorescence is down to the tip of the hair. And then I might do a fungal culture then, depending on how severe it was. And then we stop therapy. And for M. canis, I always combine systemic with topical therapy. It's real important to do that.
Okay. Can gram stains be used for skin and ear cytology?
They absolutely can. The reason that most dermatologists don't use a lot of gram staining is it takes time to do it, and it's finicky. So I know Carol Foyle was a resident with me, and when she was at LSU, she did gram stains all the time, and they were beautiful. But in a busy practice, you may not have time. So to me, if I am doing a cytology and I see, diplocoxy and clusters of coxy, it's highly likely to be staph if it's a pyoderma from a dog. I don't know that I can differentiate among rods. I think sometimes I can recognize Corynebacterium. And I kind of use my, if the dog's licking, it's probably not a Pseudomonas. If I see biofilm and toxic neutrophils, it probably is, a pathogenic gram negative. But I'll go in and use culture then to identify the organism specifically. So gosh, if you're doing gram staining, don't give it up. It's awesome. It just takes a little time and can be a little finicky, but some people just love doing that, staining, and gosh, do it.
Okay, thank you. What is the reason you can't use Apoquel in dogs less than 12 months?
So it has to do with the fact that in our safety studies, when Zoetis did safety studies, they started in very young dogs. So I think the youngest dogs were, I don't know, somewhere between 8 and 12 weeks of age. And when we do safety studies, dogs are given doses that are, the regular dose, 1x twice a day. So that would be the usual dose twice a day, three times the dose twice a day, and then 5 times the dose twice a day for 6 weeks instead of 2 weeks, which is on our label. And in the really young dogs, not all of them, but a couple of them got sick. So, and by sick, I mean seriously ill. There were, I think, a couple of pneumonias and a septicemia. So in 6-month-old dogs, when they did the same studies, none of those dogs got really, really sick, but a lot of them developed demodicosis and a lot of them developed viral warts. So when they did the safety studies in dogs 12 months of age and older, those kinds of infections didn't come up no matter how high the dose was and the duration. So that's the 12 months label. And honestly, it makes sense to me because we know that dogs less than a year of age, their immune system is still developing. And what we know from other mammals is they're very T helper 2 dependent when they're young because they got to make antibodies like crazy to everything that comes their way. And so Apoquel tends to hit the T helper 2 cytokines more than it does any T helper 1 cytokines. So once a dog is fully mature, then they tolerate Apoquel very well. So if you have a dog less than 12 months of age, you can totally use Cytopoint. And that's, kind of what I was using before I left my practice. I saw a lot of puppies with atopic dermatitis. They'd be anywhere from 5 to 7 months of age and itching like crazy. And cytokine was a great boon to those dogs.
Okay, thank you, Valerie. We only have time, unfortunately, for probably 1 or 2 more questions. We have a hard stop at 5:15. There's still a handful of questions in here. So what we can do, if you end up signing on tonight again, which I know that's a lot of fees, so we're not asking you to do that, but feel free to ask that question again, or I can see if Claire can, I guess, or email Dr. Fadak with the question. That's probably the easiest way. But I'll go over 1 or 2 more of these before we get to 5:15. So the first one is, do you feel it is safe to give oral antifungals without blood work prior?
It depends on the dog. So I will say that most of the time when I am treating for malassezia, I do not do pre-blood work. If it's a young to middle-aged dog and there's no GI history or anything to make me concerned about the liver, because honestly, 5 milligram per kilogram, even of ketoconazole, is a low dose and we rarely have problems with it. But if I have a dog with a history of a hepatic problem or an old dog, let's say, I had to put my 11-year-old Golden Cross on ketoconazole, I would want to know what his liver status was because he's an old dog. So I don't think you need to worry about it if you use those low doses. Where I've seen us get into trouble with ketoconazole is when people have used the doses that we used to use for systemic mycotic infections, where people were given 10 milligram per kilogram of ketoconazole twice a day. And then you're much more likely to have hepatic problems, in which case you would get pre-blood work. But if it's a normal, healthy, atopic dog, and it's a young dog especially, you don't necessarily need blood work ahead of time.
Okay. And then I guess the last question is bioavailability of cyclosporine increased when we combine with ketoconazole.
Yes. The absorption, well, you know what? No, I think it has to do not so much with better absorption, but it stays in the bloodstream longer. I might have to double check that. But what we know is that you can usually use half the dose. So for atopic dogs, we're usually using 5 to 7 milligram per kilogram of atopica or bioequivalent. And what we can do when we add on ketoconazole is drop it down to 2.5 milligram per kilogram. And the nice thing about the ketoconazole is you don't have to use it at an anti-malassezia therapeutic dose. There's a wonderful paper that suggests you could just use it at 2.5 milligram per kilogram. So even if you're having to use it every day, it's a low dose. And if it enables a dog who needs atopica to stay on it, then by all means, we can do that. Now, those patients, if they're taking it daily, even at a low dose, I probably would do, some blood work every 6 months on those dogs. And if after the first year I'd had 2 samples in a row that didn't have problems, I'd go to annual blood work. Really, any patient of mine that's on chronic medication of any kind is going to get annual blood work. Because a lot of these atopic dogs are aging and, they're going to acquire other things. Like I hit the jackpot with my dog. He acquired, in addition to his atopic dermatitis, food allergy, congenital deafness, and bronchoobstructive disease, he acquired not just Cushing's disease, but hypothyroidism too. So, we picked that up. He goes to what I call his real vet, and they do annual blood work on my dogs as they're aging, and we picked up, signs of Cushing's and hypothyroidism. So, if you have a protocol for annual blood work for your medications, I applaud you. But I don't, for a transient course of an antifungal, I don't think you necessarily have to have blood work initially.
All right. Thank you, Dr. Paddock, for everything. We do have to sign off here. If you'd like to register for the evening session, please visit thrivevet.com/learning. It is not the same content. It is different
Really
content
different.
tonight. So yeah, really different. More of a DVM level of content this evening. So please join us for that if you'd like. Otherwise, check out our website. We usually will attach any speaker materials to the video. There'll be a link there. So hope everybody had a wonderful time. Within an hour from now, around an hour from now, you'll get your CE certificate and a link to the recording. So if you missed any part of this, you can watch it there. All right. Well, hope everybody has a wonderful day. Thank you very much, Dr. Paddock, Dr. Jurgensen, Stacy Welsh, it's in the chat box as well. And we will see you guys a little bit later.
Great. Thank you, everyone.
Thank you, everybody.